Hello, my name is Joe Welsh of Lifesavers Incorporated out of Louisville, Kentucky. Welcome to our video series, Emergency Medical Technician Practical Skills that meets the 2019 scope of practice. Welcome to our video series again. This is Joe Welsh. We're going to be demonstrating the second part of the BVM station, which is station 4. There's a 4A, which is assembly of the BVM. Getting your patient breathing. This is section 4B. This is when you have them already stabilized with the BVM, and now we're going to put a supraglottic airway into the patient.
Been called to the scene of a 56-year-old female who is not breathing and has a low pulse of 60.
All right, again, BSI, since we just graduated from the 4A, as far as my partner is doing bag valve mask ventilations with high flow O2, I'm going to have him continue to do that while I test my equipment. And again, on this one, we're going to assume my patient is about 5'6".
5'6".
Okay. I'm going to go ahead and, again, with the purple airway, this is going to require 70 as far as the pressure. So I'm going to go ahead and pre-fill my king. Make sure there's no leaks, which is good. And then I'm going to evacuate the air out of it. And again, all it takes is a quarter turn once you have it in there. Insert it. Evacuate all the air out of it. Now, an easy way of installing this airway. All right, get a sniffing position. All right, what you want to do is you want to go ahead and open the airway, and what my technique is you go ahead and put it in at a 90-degree angle, and you hit the roof of the mouth. All right, so you basically aim for the roof of the mouth, and it goes right in. You clear the tongue that way. All right, then I'm going to push the airway in all the way to the coupling, as far as where the coupling hits the teeth, making sure my blue center line is midline on the body. I'm going to go ahead and pre-fill, or fill my balloon, my cuff. And what I'm going to do is I'm going to attach my bag valve, and then on my first breath, I'm going to seat it against the tongue. So I'm going to lift it about a ½ inch. Making sure that I have lung rise. Then what I'm going to do is I'm going to go ahead and check while my partner is bagging and make sure I have breath sounds and I have no epigastric sounds. That's my first check that I do. Once I have that, then I'm going to reconfirm by making sure I have color change on my color metric. So this started off purple. As soon as it turns yellow, I know I have CO2 present. All right? That way I do know I'm in the lungs at that point.
How would you know if you are delivering appropriate volumes with each ventilation?
I should see equal chest rise and fall, and should hear equal breath sounds.
Continue.
All right, now once I have my test and confirm my test is accurate, I'm going to go ahead and bring this around to the side of my patient because I don't want them to lay on my knot. And secure my airway and continue to bag valve mask my patient. End of skill.